All right, so Jason Francis Roxas is already here with us since in the morning, watching, listening, and now it will be his time to share his experience and expertise. Jason Francis Rojas is a Bachelor of Science in Nursing and a registered nurse. He is a certified lymphedema therapist and also lipedema specialist. He obtained his certification in lymphedema therapy in Austin, Texas in 2013 and pioneered the treatment of lymphatic diseases in the Philippines. He mentored various institutions, or he was mentored in Europe, like the Lympho-Op Clinic in Germany and the 𝐒𝐇𝐀𝑑𝐄 Hospital in the Netherlands. Wow, that's amazing. I hope I can go to Germany and Netherlands. Obtained expert clinician certification from the National Lymphedema Network, founder of the Philippines Lymphedema Network, and the educator of oncology to help in early detection of lymphedema. And that's how I found Jason Francis in his Facebook group, The Lymph. So he's the founder of the Philippines Lymphedema Network. So without further ado, we want to learn more from Jason. So welcome, Jason. Let me
Hi,
see if we can pin you. All right. So can you turn on your camera so we can see where you are? All right, I saw you. Okay, and we will going to make you as your co-host, and we're so excited to learn about your practice there. Is this the right Jason?
hi, good morning, everyone.
All right.
Just trying
Did
to
you
push
turn
down the
your video? Okay, wonderful. All right.
there. So I'm not,
Okay.
don't worry. I'm an actual person. I'm just waiting to pop up in the screen.
I thought you will do a magic.
So thank you very much, Dr. Jenny, for the invite and congratulations on this informative and fantastic lecture series. I'm not sure
Thank you,
if you
Jason.
my pic my video though.
When you share, be sure that you click those video audio on the bottom when you're doing video share. I learned from those. I can't share and I didn't click those.
Um, so I think we're still waiting for my video.
Yeah, it's still is this like your screen? Yeah. Yeah, it's
Yeah.
still okay.
Oh, also, congratulations to the previous speakers. They're fantastic.
Yes.
Especially Amanda for providing me with a wake up exercise.
Yeah. Yeah, it's
Hey,
also always it's for everybody, but she emphasized that the manual lymph drainage part there, right? She
absolutely.
incorporated that. Yeah, I didn't do that. That's a good reminder.
Okay. So I actually have a pre-recorded presentation. So I like to record my presentations to save up on time, and because I have a very hyperactive puppy here with me.
Mm-hmm.
Let me just share my screen real quick.
Okay.
Okay, I think my
Yes.
screen is showing.
Yes, we
So
got you.
please bear with me for a few minutes and please listen to this video. Thank you very much, Dr. Jenny, for the privilege and the honor of being part of this program and allowing me to share my presentation entitled Lymphedema Management in the Philippines. Do we really practice what we preach? Before we get started, allow me also to share my disclosures. So I've had honoraria from LNR and also from MEDI. When we talk about the Philippines, we normally have some preconceived notions of what the country is or represents. So first and foremost, among which, when you say the was declared as one of the new 10 wonders of the world. Of course, our Banawe rice terraces is also famous. And the Philippines wouldn't be complete unless you taste our Guinness Book of Records listed mango. This is the Carabao mango, which is listed as the sweetest mango in the world. And this is another famous or notorious dish. Depends on your taste buds. This is the balut, or unfertilized duck embryo or duck egg. Of course, we also have Manny Pacquiao, who represents the Philippines as one of the greatest boxers of all time. And just last year, our dish sinigang was declared as the tastiest soup in the world. So that's something for you gourmands out there. But despite all these many positive images that come to mind when talking about the Philippines, we have something that is not quite associated with the Philippines, and that is lymphedema management. So why is this? So throughout the course of this discussion, we're going to see some challenges that we're facing in the Philippines, as well as our journey of since 2013 up to the present when it comes to managing our patients with lipo and lymphedema. So in the Philippines, or actually globally, breast cancer is the most common type of cancer according to the World Health Organization. And the Philippines has the dubious distinction of having the highest incidence of breast cancer in Southeast Asia. Commonly, breast cancer manifests in between 45 to 50 years olds, and the 10-year survival rate is at 56%, but especially now with immunotherapy and other modalities, the survival rate is gradually but surely increasing. This information jives well with a small study that I conducted among my patients. The study lasted from 2014 September up to 2018 December. So during that period, I had 253 referrals for decongestant therapy, 76% of whom are breast cancer-related lymphedema. The median age is around 58, and the majority of these patients only had stage 2 or stage 1 lymphedema. And sadly, prior to 2013, the treatment in the Philippines only consisted of the old compression pumps, where the end would terminate at the root of the limb, be it the arm or the leg. And these pumps only had about 6 chambers, which we all know is already outdated. Passive and active exercises were also done, but maybe for about 10 minutes only. And there were no compression bandages that were applied. This is all prior to 2013. From 2013 up to 2022, we've had a great leap forward when it comes to dealing and managing lymphedema patients. And along with this leap is also a renewed or greater interest in lymphedema as a disease and the management of this disease. But of course, like any country in the world, we have some challenges that are both unique to the Philippines and challenges that are shared across all countries in the world, even the developed countries. First and foremost among these treatment barriers are the availability of treatment. So the Philippines is an island group. It's an archipelago of 7,600 islands. So if you want to go to the beach, you have your pick of which island to go to. It has 3 major islands. The first one is Luzon Island. It has 7 hospitals with CLTs. The Visayas group only has 1 hospital with a CLT. The CLT in the Visayas area is actually also a doctor. So you might expect that she doesn't do the actual lymphedema drainage, but what she does is educate the patients in self-massage, and also she prescribes the correct bandage to use and the correct garments to use. In the Visayas region, in the Mindanao region, we have 0 hospitals with CLTs. So focusing on Luzon Island, which is where I am based, it is the largest and the most populated island group in the Philippines. It's 17 times bigger than Delaware, and about the same size as Nevada. Nevada has 3 million people, while the Luzon Island group has 53 million people. So good luck with social distancing. In the whole island group of Luzon, we only have 7 treatment centers with CLTs in it. The treatment that's done in the Philippines is also the standard complete decongestive therapy, but one component or one new pillar that we added is a focus on self-care. So the CLTs that are practicing in the Philippines have trained either at the Brennan School, the Vodder School, or like me in close training. They are mostly PTs, but I am not a physical therapist. I am an oncology nurse by profession. And I started handling lymphedema patients and lipedema patients exclusively since 2013. Another difference in the treatment here in the Philippines is that we do not do wound care. Although sometimes as an oncology nurse, this is within my scope of practice. But since I'm in the hospital, we have a different center that caters to or performs wound care exclusively. We also do our own lymphatic drainage, bandaging, and fitting. Like with most American centers who do their own bandaging and lymphedema drainage, I think the fitting sometimes you can delegate to a certified fitter or the DMEs. In Europe, just to share an example, you have a different person who does the lymphatic drainage. It's a physiotherapist. After they do the lymphatic drainage, they send you off to the nurse who does the bandaging. And then when you're decongested well and your arm has or leg has successfully been reduced, then they send you off to a certified fitter. So it's like an assembly line there in Europe. We work very closely with vascular and oncology doctors. In the Philippines, we don't have a rehab medicine specialist who actually trained in the lymphedema management. But we do have vascular doctors who are well trained in the correct CDT techniques. Another big and telling difference is that the treatments are usually done twice a week. This is very different from the US, where it's done daily for 5 days. And very different also from Europe, where the patients are actually admitted to a specialist hospital. Then they do treatments at least once a day. There was this fantastic lymphedema center that I trained in Germany. It's called the Lympho-Op Clinic. So the setting is as an inpatient, and the facilities are fantastic. So during the morning, everyone has a group breakfast, and then they divide the group into upper and lower extremities. They do the lymphatic drainage. Then for the leg group, they send them off hiking because the center is close to a mountainous region. So they send the leg lymphedema patients hiking. And then the arm exercises for passive and active ROMs. Then they all meet for lunch. And then before dinner, they have another session of MLB. So in the Philippines, we usually do it twice a week, again, owing to the small number of treatment centers in the Philippines, owing to the logistics of the travel of the patients. One session would be about an hour, but of course, with the crazy traffic in the Philippines, so you'd have to allot at least 3 or 4 hours just to have a session. And of course, most patients don't have 3 or 4 hours to spend at the doctor's clinic. So we try to come up with a compromise, and we do the treatments 2 times a week with still very, very good results. The results I actually, of the 2 time a week session, I presented this at the NLN in, I think it was in Dallas, 2017. Treatment outcomes are still very good despite doing twice a week treatments. In the Philippines, CLTs rarely use compression pumps because the pumps that are available here are of the old variety. We do have some centers with a lymph press, but that's not available widely. So it's a focus really on good lymphatic drainage, good bandaging, and definitely patient compliance. Another barrier to the treatment of lymphedema is the cost of diagnosis. So like all good centers, we have at least two criteria in diagnosing lymphedema. Of course, you have your history and PE, you have your tape measurements, and you have bioimpedance studies. Some centers abroad use, of course, your pyrometry, use your water displacement method, um, and other modalities that will help in the diagnosis of lymphedema. But for the Philippines, we rely on tape measurements with a 2 centimeter size increase as listed in the ISL, and also bioimpedance studies. And the cost just of the diagnosis is around 800 pesos or $13 for a doctor's visit. Also for bioimpedance, it's about 50 USD. And in some complex patients where we require additional testing like venous compression tests, duplex venous scan, a lymphoscintigraphy, or in rare cases, we have an MRI required, the treatment cost can substantially increase. So I know this is probably much cheaper than in the US, where a very simple X-ray can run up to $300. But in the Philippines, where the average daily income is only about $11 or $13 a day, then you can imagine how crippling or how difficult it is to get these clearances before undergoing lymphedema therapy. The diagnostic machines are actually widely available. Even the lymphoscintigraphy, which is a specialized test, is widely available in all 3 island groups. A good thing is most tests are covered by private insurance companies. But the skill of the vascular technicians, especially those in the provinces, sometimes are questionable because they don't really handle lymphedema patients that often. In the center where I work for, it's automatic that if you have breast cancer related lymphedema, then you automatically include the proximal trunk quadrant and the neck that is close, the neck area that is closest to the affected arm. And unfortunately, in the province, if they do the venous compression test, they don't include these areas. Also, you need clearance from your attending medical doctor. And sometimes the attending medical doctors are not that knowledgeable about lymphedema, so they require all these unnecessary tests, like an ultrasound or an MRI or sometimes an X-ray, which we know are not really essential tools in the diagnosis of lymphedema. Another barrier to treatment is the actual cost of the lymphedema treatment in the Philippines. Like I mentioned earlier, pre-2013, there was no internationally guided treatment that's available locally. And the treatment before 2013 had no coverage by private insurance companies. It was only when I started in 2013, 2014 that I was able to convince several insurance companies to cover lymphedema treatment. So now they cover it under physical therapy, which is a different thing, you all know, but at least we were able to get around 15 sessions covered by their health insurance. Due to incorrect referrals, other patients may have other treatments before CDT. So sometimes the attending doctors just send them to a regular rehab session with PTs who are not CLTs. So out of the 15 free lymphedema sessions that they could have had with a CLT, the 15 sessions actually get diluted because they're sent to an ordinary rehab center without a rehab center that's not equipped with treating lymphedema. We also have an additional cost for the use of PhysioTouch and LymphoPress. So LymphoPress and PhysioTouch are available in select centers in the Philippines, but of course there would be an additional cost on top of the normal CBT. To remedy this, we sometimes have charity cases, or we offer free or discounted treatment for our indigent patients. The third challenge of treating lymphedema patients is the availability of supplies locally. We do have a lot of short stretch bandages. We're probably using the same brands as you do in the States. Sometimes we also use long stretch bandage with Velcro just for fixation, especially if you know of a thigh that is very irregularly shaped and that has a lot of lobules. We have a local alternative to finger bandage rather than your mololast or your half-the-last. We have this type of finger bandage. It is flesh toned and it's actually a lot more durable than mololast and cheaper too. The stockinette, we substitute that usually with an old t-shirt of the patient so that their skin is more used to the feel of the fabric. The stockinettes are widely available, but just to cut down on cost, we substitute it with something that the patient already has. The white foam is not used that often in the Philippines. I once attended an NLN session in the US, and I got to speak with a therapist from Florida. And she said that she's located in I'm not sure if it's Tampa or another county, but she said it's in the armpit of Florida. So the Philippines has a temperature peak of 40 degrees Celsius or 104 Fahrenheit. So you can imagine putting white foam and then covering it with bandages. So you can imagine how icky and how hot the skin will be underneath all these layers. So usually we skip the white foam if it's not indicated, but definitely we use nibbed or grooved foam, especially for fibrosis. We use the same variants that you may have used. Also the shaped foam. We also have some of the spaghetti foam that you're used to, the white ones. We also use that. Personally, I'm more of a fan of the spaghetti foam, but it can be a little pricey. So we use this very, very judiciously. Moving on to compression garments, we have a wide variety of off-the-shelf compression garments. Currently, we have 3 brands, a very famous German brand, trying to avoid saying any brand names, with a pink box. We have a US brand with a white and blue box, and we have a Swiss brand, especially for leg lymphedema patients, with a white and green box. Currently, we have a French brand setting up shop in the Philippines. They're mostly use the blue box as a covering. It's the only French brand that I know of. We use round knit garments, and these are prescribed mostly by their attending medical doctors. Round knit is used more often because of the price availability and because this is the garment type that the doctors are used to. But definitely, if they come into our lymphedema center staffed by CLTs, we have a preference for flat knit garments. We have them available locally for arm and leg lymphedema. Cost-wise, you'd be surprised that the price is almost the same as with the US. The only main difference is the price of CCL3 leg garments and also gloves. It's significantly more expensive here than in the US. We also have Velcro and made-to-measure compression systems. Velcro, I am a big fan of. If the patient can afford, I always go for a reduction kit. I also try to source a Velcro garment system for arm lymphedema. Unfortunately, these garments and supplies are not covered by the health card, so they are often out of pocket. And another big thing is that we do not have dedicated nighttime garments. You all know that the nighttime garments are really expensive. They run up from 200 to about 500 US. So what we do in terms of nighttime compression is we have the patients use um, their own stockings, their daytime garments, or we have them shift to bandages. In my almost 10 years of experience, I think I only used night garments for maybe 2 patients. They were able to afford these, but for all the rest, I actually have them bandaged or use their daytime compression. Another barrier or challenge in the Philippines is the government or institutional support. And I know that this is also a big challenge in the US, where we're still waiting for approval of the Lymphedema Treatment Act. So we have no government support or recognition for lymphedema patients. We do not have a national registry for lymphedema. And this is having a national registry is something that I'm very passionate about, because working as an oncology nurse, we have a national cancer registry. So it would not be a stretch to include the patients suffering from lymphedema with cancer into a combined or united registry. So we're currently working on this shortcomings by coming up with a cancer control program with a focus not just on cancer treatment, but more importantly and more applicably for us would be to address their survivorship issues as well as their quality of life issues. Because like I mentioned earlier, with the better and more improved survivorship from cancer, then the life after cancer, the life with lymphedema actually becomes more of a pressing issue now more than ever. In the absence of government support, the hospitals and the clinics actually step up to try and help indigent patients. So social services from the hospitals can defray a portion of the expenses in terms of the actual treatment, in terms of the diagnosis. But for garments, then the patients really have to cough up the expense needed for the full expense needed for the garments. Other clinics, like I have, we collect old but usable garments or bandages, and then we provide these to indigent patients, charity cases. So I make sure that the garments are actually in a usable condition. We have them sterilized first, as well as with the bandages. Your bandages, by the way, can be autoclaved. It's safe to be sterilized, steam sterilized in the hospital setting. And we have regular free consultations for indigent patients. In my clinic personally, I have 2 big events where I have free consultations. The first would be, of course, Lymphedema Awareness Week. And the second is around September or October or September, after I come back from the US from all the conferences that we have, usually in September or October. And this one is a problem, of course, that everyone's facing, not so much in Europe, but in Central, North, Latin America, Asia also, is a lack of awareness. So there are a lot of misconceptions, a lot of misdiagnosis and underdiagnosis, of course, not just in the Philippines, but in the US. And I've had a lot of patients from Guam and parts of Hawaii that actually go to the Philippines for their lymphedema treatment. And despite being in the US, so to speak, we still have many medical providers there who are not so well versed with the correct management of lymphedema, which is partly the reason why I started Lymph, so LYMPH. I founded this February 19 of 2015. It's modeled after the American National Lymphedema Network by Saskia Tayadens. And it started off as a means to inform and educate Philippine patients, specifically in an online platform. So normally we post before and after pictures of consenting patients. We do a series of short articles there about lymphedema management. And starting 2018, we branched out to provide patients with a guidance on choosing the nearest lymphedema treatment center that is more accessible to these patients. So we served off sort of as a directory. 2018, we also became a treatment guide because with the setting up of various lymphedema centers in the Philippines, most of these centers, by the way, were set up after 2017 when the local PTs had a training session in the Philippines that was conducted by myself and Dr. Brennan. In 2020, during the start of the pandemic, LymphPH actually became an online platform for scheduling of appointments and online consultations with myself. So the battle that we're facing in the Philippines is uphill. We have to reach a lot more providers. We have to reach a lot more patients so that we can educate them, so that we can share with them that there's actually hope in managing their lymphedema. And also some of these challenges I know are also shared by your experience in the US. So hopefully, and with the help of all these symposia and fora, we'd be able to engage more people and get them involved with the correct treatment of lymphedema. I'm always very happy to be part of international groups for lymphedema. I always say that for lymphedema and lipedema, we are a very small group, but this small group makes up for the lack of members, for the lack of airtime, by having very fiercely dedicated individuals that are really geared towards furthering the establishment of a national lymphedema treatment framework, and hopefully an international treatment framework also. So thank you very much for your kind attention, and I'm very happy to be able to speak before you. Have a great weekend.
Thank you so much for that chance to present before you.
All right. Thank you so much, Jason. I miss Philippines so much with that presentation, and that's really amazing. You highlight our beauty, and then you highlight what we are challenged and still what we need to improve in the lymphedema part, you know. And I want to say kudos to you because you founded the lymphedema management, of course, and the practice there. So we would like to know more about, and definitely every places are, I think you can stop your share so we can see you. I'm not sure if, how can I do that? Let me see. Okay. Because I can see your screen. I want to see your, the speaker itself. All right, there. Yeah. I keep thinking, where's your camera? Because you're still on the screen. Yeah, so that's what I'm saying, Jason. We are so glad to meet you, even not in person. So right now, what will be your projects, you know, the upcoming projects, and what are the things that you are looking forward to pursue, and the needs currently right now and how can we connect with you so that people, because we have many physical therapists watching right now, and they are the one originally who asked to present the lymphedema topic because they want to have it in their clinics. They're serving now lymphedema in some part of their clinics and want to know more. So tell us how we can connect you and your future projects, Jason.
Right. So we had a project planned for 2020. Of course, everything was delayed by COVID, but essentially this is a train the trainers type of project where I plan to set up a whole day seminar for CLTs and PTs. And on the second day of that training, we have our actual hands-on. So this would serve as both as a review of the skills that we learned during the basic training, and also it will serve as a new venue to showcase that, hey, we have these new types of products that we can use for patients. We have a new update on in terms of manual lymphatic drainage, especially there was this fibrosis melting technique that was developed by one CLT in the US where you sort of like squeeze the fibrotic area. I think she called it the white knuckle approach. So you squeeze the fibrotic area and you just feel that the fibrosis melts like butter. So these are interesting techniques that we can use that we can further the education of CLTs in the Philippines. With regard to PTs who are not yet CLTs, I think we should invite you also to one of our discussions. So we have regular planned lymphedema summits. We had one last February covering the vascular doctors. So slowly but surely, we're trying to raise awareness, and everything, of course, is a team effort. So I'd like to also thank the doctors, the nurses, the aides in our hospital who are part of the team and in setting up the lymphedema network. Oh, and also my mentors internationally. Thank you so much.
Yeah, I really amazed with your um experience, and then also your education in Texas. So you traveled America in different states just to do all those mentorship, and also those certification, different courses and seminars. So it slows you down. You're so sad last time because the Learn seminar is only virtual. You used to go there in person, I'm sure. So thank you so much. And how can we connect with you? Any emails, or we know the Facebook link, but I'm not sure about the others, so we can write in the chat as well.
Absolutely. Thank you.
Yeah. Tell us your email, or so that we can write.
My email address is jfrancis. So that's just the letter J,
Mhm.
Francis dot Roxas, Roxas at gmail.com. I'll also put this in the chat box. And of course, you can go to the Philippine Lymphedema Network. Just type it on Facebook and click like to be part of the group. That's how I met Dr. Jedi, by the way.
Yes. Is the Philippine Lymphedema Network the same as the one I'm messaging you, the lymph?
Yes, that's it. Lymph.
Okay. Yes, so the logo is lymph, but it will be like a Philippine. That's really nice logo. The flag is there on the PH part. Okay, congratulations, Jason. We are so fortunate for you to have with us here in our Lymphedema Summit and sharing all your experiences. We would like to connect with you. I see in your presentation that very seldom the manual lymphatic, what you call the pump.
Yes.
So we have one speaker last November, and he told me, so he is our main resource here as for the manual pump, and he said that he is also partnered in Philippines, a distributor, so he can send it from here, ordered here, and he can also deliver it in Philippines. So I will connect with him. What's the name of that distributor, or how does it work? Because definitely that's a good network for you and the hospitals that you serve. All right. Yes. Thank you so much again, Jason. We appreciate you. Any questions, guys, by the way, so far? And Anna said, very nice person, great job, Jason. Yes. That's really nice presentation, Anna. Thank you so much. And any questions, guys, just put it there.